3, 2, 1, and yep. Okay, so let's say Alan has some pain with dorsiflexion, okay, and he's getting to a certain stage where it doesn't feel like it's blocked, it doesn't feel it's tight in the calf, he actually feels pain in the area where he had his injury, so usually around the area of the ATFL. What we'd do, I'll get you to hold that. First of all, stay there. So simple symptom modification, just doing a posterior glide on the lateral malleolus. I generally glide in the direction that we would usually take with this technique, which is sort of posterior and superior. Don't get in underneath the lateral malleolus and pull up. If they've got an ATFL pain, then they're not going to like that. So you want to get a couple of centimetres off. Obviously you would have ruled out a fracture here, so there shouldn't be tender over the bone. And you're sort of pulling up and back, and then get them to go into dorsiflexion again. Okay, how does that feel? Good. Yeah, and then come back. And then if that feels better, we'd go with that technique. If not, coming over onto the posterior surface of the fibula, and it will get you to sort of push forwards and down, and then get them to do that movement again, and see which one feels more comfortable. Okay. If their pain is more with plantar flexion or inversion, then we would assess that. All right, I'll just get you to point the foot down for me, Alan. How's that feel?
Good.
Any pain?
No.
Yes? Okay, and then we'll do the same thing. So coming up a couple of centimetres from the distal aspect of the fibula there, pushing back and down, and then we'll get you to straighten it. See how that feels. Come back, and then push on the back, and then get them to do the same thing, see how that feels. And then you can do exactly the same thing with inversion, so I'll get you to turn it in. If they're getting pain there, come back, push backwards, do the same thing, and then push forwards and do the same thing. And then it might be a combination of plantar flexion and inversion that brings us symptoms on. We would do the same thing. Okay. So once we've established our direction, then we go about the taping technique, and I guess the beauty of this is that it's very quick, because if you're limited for time, sometimes a full ankle taping, especially if you do it poorly like me, can take a long time. This is very quick, and it's very quick and easy for the patient to do themselves. So again, you're sort of starting up about 2 centimetres up on the fibula, and then going about 2 centimetres anteriorly. Okay, place the taping there, and then wrap around so that it comes up onto the back of the calf there. Usually only need 1 strip of Fixamol, and then I usually do 2 strips of taping. So 1 here, and the important thing is that you're applying some pressure, you're applying a glide, and then taking up the slack with the taping. So pushing back here, taking up the slack, and then pulling around and taping on the calf there. All right, and then we'll just reinforce it, overlap up a little bit higher. Pushing back. And then taping up there.
Where are you finishing that, sorry? On point 2. Okay, yeah.
Yeah.
Cool.
All right. I'll leave the camera there. Sorry. And then basically the opposite. Now, the opposite is a little more difficult because you're going to be sort of taping, or you have to be careful not to tape over the ankle joint line because it might restrict their range of motion. Here, you're sort of free of that. So after you do it, you're just going to make sure that they can move okay. So basically, sorry, I'll just get you to angle the foot that way a bit. Yep. And the same sort of thing, direction of the tape is fairly similar. So bony part up here, going up About 2 centimeters, probably started a little bit low down there. And then pulling forward and sort of a little bit more, I guess, longitudinally up towards the big toe there. How does that feel?
Yeah, good.
And then reinforce that with one more strip. Like so.